scholarly presentation. The article that I was assigned was Managing Cardiovascular Risks with Tai Chi in People with Coronary Artery Disease. So the purpose of this article was to determine whether or not Tai Chi helped or hurt or made no effect on people with cardiovascular disease, and also to see if it improves their cardiovascular health. As nurses, we want to be patient advocates, and being a patient advocate includes maintaining people's health as long as possible, which includes avoiding illnesses and maintaining their healthy lifestyles. The Tai Chi was the point of that during this article and this study, was to see if that would help people maintain a healthier lifestyle. So the main question asked in this study was, will Tai Chi help people with cardiovascular disease live a better life? And so the study goes into determining, with research, whether or not Tai Chi is capable of that. The objectives were to determine the effects of Tai Chi on cardiovascular risks, health behaviors, and quality of life. The hypothesis stated in this study was Tai Chi will be effective in helping decrease problems in people with cardiovascular disease. So this problem is pretty significant to the nursing practice. We want to have interventions that are the best for our patients, and they can include being low cost. Obviously, we want our interventions to be highly successful. Low tech allows it to be a lower cost and makes it more accessible to the community and people who might not have the financial means to get more expensive interventions. So there's multiple variables in this study, and in most studies. The independent variable is what the researcher manipulates and changes throughout the study. In this case, the independent variable was the amount of education that each of the participants were getting during the study. The dependent variable is the item that changes based on the manipulation of the independent variable. In this case, in the study, the cardiovascular risk factors were a dependent variable, along with health behaviors and quality of life. The different interventions that were placed in this study was mainly the amount of education that each of the participants was receiving. The first group was the Tai Chi group with education, so they would get exercise instruction, nutrition classes, and also stress management classes along with their Tai Chi. The second group was the Tai Chi exercise only, so they were not exposed to the other education that the first group was receiving. So the design of this study was a quasi-experimental design with a non-equivalent control group. This design dictates the manipulation of the independent variable, which we have just talked about. The setting was in a public meeting place once per week. In this case, it was on a Saturday morning, and that's where the first group would receive their education, their nutrition, and their stress management education. For both groups, they had 3 times a day, or 3 times a week, at the homes of each participant, where they would conduct their Tai Chi exercises. This sample included 85 people with a mean age of 65 years old. So the cardiovascular risk management program was held for 6 months. This included the Tai Chi exercise program, the nutritional education, and the stress management classes. And the data was collected via pre- and post-tests to tell the difference between the participants. So the results show that the Tai Chi with education was statistically significant in modifiable cardiovascular risk factors. It was safely implemented as an alternative form of cardiovascular risk management. So there are limitations on this study, as with most studies out there. There was a gender distribution shift from the beginning of the study with everybody who took the pre-test. There was people lost to follow-up to the post-test. So there was an equal number of male and females in the post-test in the beginning, but throughout those 6 months, some people dropped out, which indicated a gender distribution shift, so it wasn't equal with each gender by the end of the post-test. Another limitation of this study could have been that the date of education was not working for everybody. The date that people would receive their education was Saturday morning, and that was disadvantageous to the maternal role because you're supposed to be home with your family on Saturday morning, so a lot of women were not able to make it to the education sessions, so then that could also have contributed to the gender distribution shift throughout the study. So coronary artery disease interventions, we want them to be low cost and highly successful, and that's actually what Tai Chi has been doing in this study. It represents low cost, low tech, and it's also highly accessible. Another quality thing that the Tai Chi intervention brings is that it can be practiced in the clinical or the community setting, making it more accessible to a larger population. So Tai Chi was safely implemented as an alternative form of exercise for cardiovascular risk management. And that's my presentation. Thank you.